Clinical incident investigation forms a critical part of delivering great healthcare. Even though we strive to do no harm, it's acknowledged that our complex systems, although they continually evolve, are not yet perfect. Sometimes things don't go entirely as planned, and on rare occasions, problems in the way in which we do things can result in patient harm. Within this context, clinical incident management is critical to minimising harm. We use investigation to understand why an incident might have occurred, and most importantly, we investigate in order to make change, to put in place strategies to make our systems safer in the future. WA Health Policy highlights three critical purposes of clinical incident management. The first of these is to identify when patients are harmed and implement strategies to minimise that harm. This links to our overarching duty of care to our patients, but also to our open disclosure policy and procedures. The second element of best practice is to ensure lessons are learned, seeking ways in which we can share these lessons across different facilities and regions, and therefore reducing the risk of similar events occurring at another location. The third element involves the identification of hazards before they cause patient harm and undertaking clinical risk management. This focuses on investigating not only adverse events, but also near misses. There are a number of different stakeholders in the clinical incident management process. First and foremost, this involves our duty of care to our patients and our consumers to provide healthcare services that are safe and of the highest quality possible. We also have a duty of care to our colleagues to ensure that our systems of work are safe and we do not expose our staff to personal or professional risks by virtue of the way in which we do business. Underpinning this duty of care is the overarching safety and quality agenda, alongside our clinical governance agenda, which includes meeting our regulatory requirements, accreditation requirements, and our medico-legal and political obligations. The clinical incident management process is a critical part of our cycle of continuous improvement in what we do across WA Health, no matter what the clinical context. The simple objective of clinical incident investigation is to identify what went wrong, why it went wrong, and most importantly, what we need to change to make sure that it doesn't happen again. The clinical incident management process is supported by three key documents. First, the policy, which sets out the basic requirements. Then next, there is a set of guidelines, which sets out the clinical incident management processes in more detail. And finally, a toolkit, which provides a suite of useful techniques and tools that can be used in the clinical incident management process and provides a wealth of information to help us in our investigations. The clinical incident management processes in WA Health are supported by a network of safety and quality professionals who will guide and assist you in any investigation, risk assessments, and other patient safety initiatives. Locally, your clinical risk coordinators are able to provide invaluable support and answer any questions that you might have in relation to the clinical incident management process.